with one answering present. The bill is passed.
Last week, as most U.S. House Republicans took news of a passed budget bill as a celebration, Annie Lee worried about the
approximately 120,000
Coloradans that could be impacted by it.
Healthcare as a fundamental human right is something that is in jeopardy with this bill.
Lee is the CEO and president of Colorado Access, an organization that provides services for people on Medicaid. Right now, the 1,000-page bill would cut Medicaid spending by $700 billion over the next decade and add a work requirement for some of its recipients.
We're talking about up to $57 million that it would cost to get our systems ready to take on the work requirements. These are all things that are going to hit Colorado particularly hard, as this bill shifts the burden of cost to states.
We're going to have to do an incredible amount of work to gap that care here in Colorado.
Jax Gonzalez is the political director for One Colorado. They fear what this bill would mean for transgender folks. Right now, it bans Medicaid from covering transition-related care.
To end access to the care would mean thousands of people in Colorado lose access to their medicine that helps them stay alive.
Gonzalez says an estimated 5,000 Coloradans would be impacted by this change, but they know it could have been more. Last week, Governor Polis signed a law that requires private insurance plans to cover gender-affirming care. For them, it's a little victory in a big battle. Gonzalez says after Pride Month, One Colorado is planning a statewide tour outside of the metro area to understand how this new Colorado law covering gender-affirming care is being implemented. As for those who may lose their coverage, they are trying to find ways to fill that gap for them.
And you mentioned the private care. Do they feel like that's a little bit murky, or what are the problems with that?
No, I mean, with this new law, private insurance would have to cover gender-affirming care. It's those under Medicaid that they're super concerned about. And, you know, a report by the William Institute at UCLA Law found that 180,000 trans people across the country use Medicaid. So it's a significant amount of people.
And 5,000 here in Colorado.
Exactly, yeah.
Wow.
Shalisa, thank you.
Thank you.